Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A nurse is preparing to administer vitamin K to a newborn. What is the primary purpose of this medication? A. Prevent eye infections. B. Prevent bleeding due to low clotting factors. C. Treat neonatal jaundice. D. Prevent hypoglycemia. Correct answer, B. Prevent bleeding due to low clotting factors. Rationale: newborns have low levels of vitamin K, which is needed to produce clotting factors. Vitamin K prevents vitamin K deficiency bleeding, VKDB. Question 2. Which medication is routinely administered to a newborn to prevent ophthalmia neonatorum? A. Vitamin K. B. Erythromycin ophthalmic ointment. C. Hepatitis B vaccine. D. Ampicillin. Correct answer, B. Erythromycin ophthalmic ointment. Rationale: erythromycin eye ointment prevents neonatal eye infections caused by organisms such as Neisseria gonorrhoeae. Question 3. The nurse explains to the parents that the hepatitis B vaccine is routinely given. A. At 6 months of age. B. Within the first 24 hours after birth. C. At 1 year of age. D. Only if the mother has hepatitis B. Correct answer, B. Within the first 24 hours after birth. Rationale: the first dose of the hepatitis B vaccine is recommended for all medically stable newborns within 24 hours of birth. Question 4. Which route should the nurse use to administer vitamin K to a healthy newborn? A. Intravenous. B. Intramuscular. C. Oral. D. Subcutaneous. Correct answer, B. Intramuscular. Rationale: vitamin K is routinely administered as a single IM injection into the vastus lateralis muscle. Question 5. A newborn's mother is positive for hepatitis B surface antigen, HBsAg. Which intervention is most appropriate? A. Delay all vaccinations. B. Administer both the hepatitis B vaccine and hepatitis B immune globulin, HBIG. C. Give vitamin K only. D. Administer erythromycin only. Correct answer, B. Administer both the hepatitis B vaccine and hepatitis B immune globulin, HBIG. Rationale: infants born to HBsAg-positive mothers should receive both HBIG and the hepatitis B vaccine within 12 hours of birth. Question 6. The nurse should administer erythromycin ophthalmic ointment by A. Applying it directly to the cornea. B. Placing a ribbon of ointment inside the lower conjunctival sac. C. Instilling 1 drop into each eye. D. Applying it to the eyelids only. Correct answer, B. Placing a ribbon of ointment inside the lower conjunctival sac. Rationale: the ointment should be applied to the lower conjunctival sac without touching the applicator tip to the eye. Question 7. A parent asks why their baby needs vitamin K if they plan to breastfeed. Which response by the nurse is best? A. Breast milk contains plenty of vitamin K. B. Newborns naturally have low vitamin K levels, regardless of feeding method. C. Formula-fed babies don't need vitamin K. D. Vitamin K is only given to premature babies. Correct answer, B. Newborns naturally have low vitamin K levels, regardless of feeding method. Rationale: all newborns have low vitamin K stores and require supplementation to prevent bleeding. Question 8. Which assessment finding requires the nurse to hold the hepatitis B vaccine and notify the healthcare provider? A. Birth weight of 1.8 kilograms 4 pounds in a stable infant of an HBsAg-negative mother. B. Heart rate of 140 beats/min. C. Respiratory rate of 42 breaths/min. D. Temperature of 36.8 degrees Celsius 98.2 degrees Fahrenheit. Correct answer, A. Birth weight of 1.8 kilograms 4 pounds in a stable infant of an HBsAg-negative mother. Rationale: for medically stable infants weighing less than 2,000 g born to HBsAg-negative mothers, the hepatitis B vaccine is generally deferred until 1 month of age or hospital discharge. Question 9. Which statement by a new nurse indicates correct understanding of newborn medications? A. Vitamin K prevents eye infections. B. Erythromycin prevents bleeding. C. Vitamin K helps prevent serious bleeding in newborns. D. The hepatitis B vaccine is optional before discharge. Correct answer, C. Vitamin K helps prevent serious bleeding in newborns. Rationale: vitamin K is administered to prevent hemorrhagic disease, vitamin K deficiency bleeding, in newborns. Question 10. The nurse is preparing medications for a newborn. Which medication should be administered first according to routine newborn care? A. Oral glucose. B. Vitamin K injection. C. Acetaminophen. D. Iron supplement. Correct answer, B. Vitamin K injection. Rationale: vitamin K is routinely administered shortly after birth to prevent bleeding. It is one of the standard newborn medications given before discharge, along with erythromycin eye ointment and the hepatitis B vaccine. Question 11. A newborn receives erythromycin ophthalmic ointment. Which statement by the nurse is most accurate? A. This medication prevents newborn jaundice. B. This medication prevents bacterial eye infections acquired during birth. C. This medication strengthens your baby's immune system. D. This medication treats neonatal seizures. Correct answer, B. This medication prevents bacterial eye infections acquired during birth. Rationale: erythromycin ophthalmic ointment helps prevent ophthalmia neonatorum caused by exposure to bacteria during delivery. Question 12. The nurse is preparing to administer vitamin K. Which muscle is the recommended injection site? A. Deltoid. B. Ventrogluteal. C. Vastus lateralis. D. Dorsoglutea. Correct answer, C. Vastus lateralis. Rationale: the vastus lateralis muscle is the preferred IM injection site for newborns because it is well developed and minimizes the risk of nerve injury. Question 13. A newborn's parents refuse the vitamin K injection. Which complication should the nurse explain may occur? A. Hearing loss. B. Vitamin K deficiency bleeding, VKDB. C. Congenital heart disease. D. Respiratory distress syndrome. Correct answer, B. Vitamin K deficiency bleeding, VKDB. Rationale: without vitamin K, newborns are at increased risk for serious bleeding, including intracranial hemorrhage. Question 14. The nurse is caring for a newborn whose mother is HBsAg positive. When should HBIG be administered? A. Within 12 hours after birth. B. At 2 months of age. C. At hospital discharge. D. At the first pediatric visit. Correct answer, A. Within 12 hours after birth. Rationale: HBIG should be given within 12 hours of birth, along with the hepatitis B vaccine, to provide immediate passive immunity. Question 15. Which newborn medication is administered to provide active immunity? A. Vitamin K. B. Erythromycin ointment. C. Hepatitis B vaccine. D. HBIG. Correct answer, C. Hepatitis B vaccine. Rationale: vaccines stimulate the body's immune system to produce antibodies, providing active immunity. Question 16. A newborn receives HBIG after delivery. The nurse understands this medication provides A. Active immunity. B. Passive immunity. C. Long-term immunity only. D. Protection against all childhood diseases. Correct answer, B. Passive immunity. Rationale: HBIG contains preformed antibodies that provide immediate but temporary protection. Question 17. Which nursing action is appropriate after administering vitamin K? A. Massage the injection site vigorously. B. Observe the newborn for bleeding or adverse reactions. C. Apply a heating pad to the injection site. D. Delay feeding for 4 hours. Correct answer, B. Observe the newborn for bleeding or adverse reactions. Rationale: The nurse should monitor for any injection site reactions and ensure the medication was well tolerated. Question 18. Which newborn medication helps prevent transmission of gonococcal eye infection? A. Vitamin K. B. Erythromycin ophthalmic ointment. C. Hepatitis B vaccine. D. HBIG. Correct answer, B. Erythromycin ophthalmic ointment. Rationale: erythromycin is routinely given shortly after birth to prevent gonococcal ophthalmia neonatorum. Question 19. Which statement by a parent indicates a need for further teaching about the hepatitis B vaccine? A. My baby will receive more doses later. B. The vaccine helps protect my baby from hepatitis B infection. C. One dose at birth provides lifetime protection. D. The first dose is recommended soon after birth. Correct answer, C. One dose at birth provides lifetime protection. Rationale: the hepatitis B vaccine requires a complete series of doses for long-term protection. Question 20. The nurse is preparing medications for a healthy newborn. Which sequence is most appropriate? A. Vitamin K erythromycin eye ointment hepatitis B vaccine. B. Hepatitis B vaccine oral glucose vitamin K. C. Erythromycin eye ointment iron supplement HBIG. D. Vitamin C hepatitis B vaccine erythromycin. Correct answer, A. Vitamin K erythromycin eye ointment hepatitis B vaccine. Rationale: routine newborn medications include vitamin K, erythromycin ophthalmic ointment, and the hepatitis B vaccine. This sequence follows common newborn care practices and ensures protection against bleeding, eye infections, and hepatitis B. Question 21. A newborn is scheduled to receive routine medications. Which medication should the nurse verify before administration by checking for a history of erythromycin allergy? A. Vitamin K. B. Erythromycin ophthalmic ointment. C. Hepatitis B vaccine. D. Big. Correct answer, B. Erythromycin ophthalmic ointment. Rationale: although rare in newborns, the nurse should verify allergies and monitor for reactions to erythromycin. Question 22. Which statement by the nurse best explains why vitamin K is administered shortly after birth? A. It improves your baby's vision. B. It helps your baby's blood clot normally. C. It prevents hearing loss. D. It treats jaundice. Correct answer, B. It helps your baby's blood clot normally. Rationale: vitamin K promotes the production of clotting factors and prevents serious bleeding in newborns. Question 23. Which finding should the nurse report immediately after administering a newborn medication? A. Mild sleepiness after feeding. B. Swelling of the lips and difficulty breathing. C. Brief crying during the injection. D. Small amount of ointment around the eyelids. Correct answer, B. Swelling of the lips and difficulty breathing. Rationale: these findings suggest a severe allergic reaction requiring immediate intervention. Question 24. Which medication is not routinely administered to every healthy newborn? A. Vitamin K. B. Erythromycin ophthalmic ointment. C. Hepatitis B vaccine. D. Ampicillin. Correct answer, D. Ampicillin. Rationale: ampicillin is only given when there is a suspected or confirmed infection, not as routine newborn care. Question 25. The nurse is teaching parents about the hepatitis B vaccine. Which statement indicates correct understanding? A. My baby only needs one dose. B. My baby will need additional doses according to the immunization schedule. C. The vaccine is only needed if I have hepatitis B. D. The vaccine prevents all liver diseases. Correct answer, B. My baby will need additional doses according to the immunization schedule. Rationale: the birth dose is the first in a multi-dose vaccine series. Question 26. A nurse is documenting routine newborn medications. Which documentation is most important? A. Baby cried during injection. B. Medication name, dose, route, time, and injection site. C. Parent's favorite feeding method. D. Length of the newborn's fingernails. Correct answer, B. Medication name, dose, route, time, and injection site. Rationale. Complete documentation ensures safe, accurate medication administration and continuity of care. Question 27. Which newborn is most likely to receive HBIG? A. Infant born to a mother with seasonal allergies. B. Infant born to a mother who is HBsAg positive. C. Infant born by cesarean section. D. Infant with physiologic jaundice. Correct answer, B. Infant born to a mother who is HBsAg positive. Rationale. HBIG provides immediate passive protection against hepatitis B for infants exposed at birth. Question 28. A parent asks if erythromycin ointment may temporarily blur the baby's vision. Which response by the nurse is best? A. Yes, temporary blurred vision is expected and resolves on its own. B. No, the ointment never affects vision. C. The ointment permanently changes eyesight. D. The ointment should be washed out immediately. Correct answer, A. Yes, temporary blurred vision is expected and resolves on its own. Rationale. Temporary blurred vision is a normal effect of the ointment and does not require treatment. Question 29. Which medication should the nurse verify using two patient identifiers before administration? A. Vitamin K only. B. Hepatitis B vaccine only. C. Erythromycin only. D. All newborn medications. Correct answer, D. All newborn medications. Rationale. Every medication administered to any patient, including newborns, requires verification using two patient identifiers to prevent medication errors. Question 30. The nurse has completed routine newborn medication administration. Which outcome indicates the medications were effective? A. No signs of bleeding, no evidence of eye infection, and the newborn has received protection against hepatitis B. B. The newborn sleeps continuously for 24 hours. C. The newborn no longer requires feedings. D. The newborn does not cry during assessments. Correct answer, A. No signs of bleeding, no evidence of eye infection, and the newborn has received protection against hepatitis B. Rationale. Routine newborn medications are intended to prevent vitamin K deficiency bleeding, VKDB, ophthalmia neonatorum, and hepatitis B infection, providing the newborn with essential early protection. Comment your score out of 30 below. If this video helped you, don't forget to like, subscribe, and share it with a fellow nursing student. I'll see you in the next NCLEX practice session.